Chronic diseases are ongoing battles that millions face daily. These conditions, heart disease, diabetes, cancer, cast a long shadow over global health. They're the leading cause of death worldwide and place a huge burden on healthcare systems. The costs of treatment, medication, and lost productivity are staggering. As future doctors, you'll be on the front lines of this battle. Understanding chronic diseases is essential. You'll need to diagnose accurately, manage effectively, and provide compassionate care. This guide is your crash course in chronic disease management. We'll delve into the science behind these conditions and explore the intricate ways they affect the body. This is about more than memorizing facts. It's about connecting with your patients. Empower them to take control of their health. Chronic diseases are rarely straightforward and often involve multiple body systems. They require a holistic approach to treatment, considering lifestyle factors, genetic predispositions, and overall well-being. By blending scientific knowledge with empathy, you can become a true advocate for your patients. This journey starts now. Let's dive in and explore the world of chronic diseases together. We begin our journey into cardiovascular diseases with hypertension, often called the silent killer. Hypertension strains the heart and blood vessels, putting individuals at risk for serious health problems like heart attacks, strokes, and kidney disease. Early detection and management are key to preventing these complications. Lifestyle modifications, such as reducing salt intake and maintaining a healthy weight, play a crucial role. Encourage your patients to monitor their blood pressure regularly and adopt heart-healthy habits. Coronary artery disease, CAD, affects the arteries supplying blood to the heart muscle. Atherosclerosis, a buildup of plaque, narrows these arteries, restricting blood flow. This can lead to chest pain, angina, and in severe cases, heart attacks. Lifestyle modifications such as a heart-healthy diet and regular exercise can slow down and even reverse plaque buildup. Medications such as statins and aspirin can further manage the condition. Timely diagnosis and treatment are essential to prevent life-threatening complications. Encourage your patients to be aware of their risk factors and actively manage their heart health. Congestive heart failure, CHF, is a condition where the heart struggles to pump blood effectively. CHF often develops gradually as a consequence of other cardiovascular diseases. Managing CHF focuses on improving the heart's pumping ability and relieving symptoms. Medications such as ACE inhibitors and diuretics can help lower blood pressure and remove excess fluid. Lifestyle modifications such as limiting salt intake and engaging in regular exercise are also essential. Empower your patients to understand their condition and make lifestyle changes that support their heart health. Peripheral artery disease, PAD, affects the arteries in the limbs, most commonly the legs. The primary symptom of PAD is claudication, a cramping pain in the legs during walking. Early diagnosis and treatment are crucial to preventing complications like non-healing ulcers and gangrene. Lifestyle modifications such as smoking cessation and regular exercise can improve blood flow. Encourage your patients to be aware of the signs and symptoms of PAD and seek medical attention if needed. Chronic obstructive pulmonary disease, COPD, obstructs airflow and makes breathing a labored effort. COPD includes chronic bronchitis and emphysema, both of which obstruct airflow. Smoking is the primary culprit behind COPD. Managing COPD focuses on slowing disease progression and improving quality of life. Medications, such as bronchodilators and inhaled corticosteroids, can help open up the airways. Pulmonary rehabilitation programs can teach breathing exercises. Encourage your patients to quit smoking and adhere to their treatment plans. Asthma is characterized by inflammation and narrowing of the airways. Triggers like pollen and dust mites cause the airways to constrict and produce excess mucus. Managing asthma involves avoiding triggers and using medications to control inflammation. Quick relief inhalers provide immediate relief during an asthma attack. Encourage your patients to develop a personalized asthma action plan. Sleep apnea is characterized by repeated pauses in breathing during sleep. The most common type is obstructive sleep apnea, where the airway becomes blocked. Treating sleep apnea often involves lifestyle modifications and CPAP therapy. Encourage your patients to be aware of the signs and symptoms of sleep apnea. Treating sleep apnea can improve sleep quality and reduce health risks. Diabetes mellitus is characterized by high blood sugar. In type 1 diabetes, the immune system attacks insulin-producing cells. In type 2 diabetes, the body becomes resistant to insulin. Managing diabetes involves monitoring blood sugar levels and making healthy lifestyle choices. Type 1 diabetes requires lifelong insulin therapy. Encourage your patients to become active participants in their care. Dyslipidemia involves an imbalance of cholesterol in the blood. LDL cholesterol clogs arteries, while HDL cholesterol helps remove excess cholesterol. Managing dyslipidemia involves lifestyle modifications and, in some cases, medications. Encourage your patients to get their cholesterol levels checked regularly, understand their lipid profile, and work with healthcare providers to manage cholesterol levels. Protect their heart health. Obesity is a chronic disease characterized by excessive body fat that impairs health. It results from a complex interplay of genetic, environmental, and behavioral factors. Excess body fat triggers metabolic disturbances, increasing the risk of numerous health problems. Managing obesity requires a comprehensive approach, including healthy diet and physical activity. In some cases, medications or bariatric surgery may be considered. Encourage your patients to seek support from healthcare professionals. Even small, sustainable changes can have a significant impact on health outcomes. Let's turn our attention to the kidneys, those remarkable organs that filter waste and maintain fluid balance. Chronic kidney disease, or CKD, is like a slow leak in a filtration system. Often CKD develops silently with few symptoms early on. As kidney function declines, waste builds up, causing complications like high blood pressure and heart disease. Diabetes and high blood pressure are leading causes of CKD. Early detection and management are crucial to slowing CKD progression. Regular blood pressure and urine tests are essential, especially for those at risk. Next, we'll address a condition that's as painful as its name suggests. Nephrolithiasis, more commonly known as kidney stones. Imagine sharp, crystal-like formations lurking within the kidneys or urinary tract, obstructing the flow of urine and causing excruciating pain. Kidney stones form when certain substances in the urine, such as calcium, oxalate, and uric acid, become concentrated and crystallize. These crystals can grow in size, ranging from tiny grains of sand to larger stones that can block the urinary tract. The pain associated with kidney stones is often described as sharp, cramping, or stabbing, typically felt in the back or side below the ribs. The pain may radiate to the lower abdomen and groin as the stone travels down the ureter, the tube connecting the kidney to the bladder. Treatment for kidney stones depends on the size and location of the stone. Small stones may pass on their own with plenty of fluids and pain relievers. Larger stones may require medical intervention, such as shockwave lithotripsy, which uses sound waves to break up the stones, or ureteroscopy, where a thin scope is inserted to remove or break up the stone. Encourage your patients to stay hydrated, especially during warmer months or if they have a history of kidney stones. Dietary modifications, such as reducing sodium intake and limiting foods high in oxalate, may also help prevent stone formation. As we've explored these renal and urological conditions, it's crucial to remember that the kidneys and urinary tract are intricately connected. Problems in one area can have ripple effects throughout the system. For instance, chronic kidney disease can increase the risk of urinary tract infections, or UTIs, due to impaired immune function and difficulty emptying the bladder completely. Conversely, recurrent UTIs, especially if left untreated, can damage the kidneys over time, potentially contributing to CKD. Moreover, conditions like diabetes and hypertension, which are leading causes of CKD, can also damage the blood vessels and nerves that supply the bladder and urinary tract, potentially leading to urinary incontinence, difficulty emptying the bladder, and other urological problems. This interconnectedness highlights the importance of a holistic approach to renal and urological health. Encourage your patients to be proactive about their health by staying hydrated, maintaining a healthy weight, controlling blood sugar and blood pressure, and seeking medical attention for any concerning symptoms. We now turn our attention to the gastrointestinal and hepatic systems, where digestion, metabolism, and detoxification take center stage. And we begin with a silent threat to a vital organ, chronic liver disease. The liver performs over 500 vital functions, from filtering toxins to producing bile for digestion. Chronic liver disease damages the liver over time, leading to scarring and impaired function. This scarring, known as cirrhosis, hinders the liver's ability to perform its tasks. Causes include viral hepatitis, excessive alcohol consumption, and non-alcoholic fatty liver disease. Symptoms often don't appear until significant damage has occurred, making early detection crucial. Managing chronic liver disease involves addressing the underlying cause and preventing further damage. Encourage awareness of liver health, especially with risk factors like viral hepatitis, heavy alcohol use, or obesity. Next, we delve into inflammatory bowel disease, or IBD, chronic conditions causing inflammation and ulcers in the digestive tract. Imagine your digestive system under constant attack from its own immune system. Crohn's disease and ulcerative colitis are the main types of IBD. They differ in location and pattern of involvement. The exact cause of IBD remains a mystery, involving genetic predisposition, environmental triggers, and an overactive immune response. Managing IBD involves reducing inflammation, controlling symptoms, and preventing complications. Encourage patients to work closely with healthcare providers for a personalized treatment plan. This helps them live a full and active life. Our final stop in the gastrointestinal system takes us to a condition that's often dismissed as merely heartburn, but can have significant consequences if left untreated: gastroesophageal reflux disease, or GERD. Imagine the contents of your stomach, including acidic digestive juices, making an unwelcome return trip up your esophagus, the tube that connects your mouth to your stomach. GERD occurs when the lower esophageal sphincter, or LS, a ring of muscle that acts like a valve between the esophagus and stomach, weakens or relaxes inappropriately, allowing stomach acid to flow back up into the esophagus. This reflux of acid irritates the lining of the esophagus, causing the burning sensation known as heartburn. Other common symptoms include regurgitation, a sour or bitter taste in the mouth, chest pain, difficulty swallowing, and a chronic cough. While occasional heartburn is common, frequent or persistent symptoms warrant medical attention. Lifestyle modifications such as losing weight, avoiding trigger foods like fatty or spicy foods, and not eating before bed can help reduce reflux. Medications such as antacids, H2 blockers, and proton pump inhibitors can neutralize stomach acid or reduce its production. Encourage your patients to seek medical advice if they experience frequent or bothersome GERD symptoms. Untreated GERD can lead to complications like esophagitis, inflammation of the esophagus, esophageal ulcers, and even a precancerous condition called Barrett's esophagus. And there you have it, future doctors, a glimpse into the complex and interconnected world of chronic diseases. These conditions, as you've seen, aren't just diagnoses in a textbook. They're real-life challenges that millions face every single day. They demand not just our medical expertise, but our compassion, our empathy, and our unwavering commitment to improving lives. The future of chronic disease management hinges on a collaborative approach. It requires us to bridge the gap between medical advancements and patient-centered care. It calls for us to empower individuals with the knowledge and tools to take charge of their health, to make sustainable lifestyle changes, and to become active participants in their own well-being. As you embark on your medical journeys, remember that you're not just treating diseases, you're treating people. People with stories, with families, with hopes and dreams. Let's strive to be not just their doctors, but their advocates, their partners in navigating the complexities of chronic illness. The road ahead may be challenging, but the impact you can make is immeasurable. Let's work together to transform the landscape of chronic disease management, one patient, one innovation, one step at a time.